Hi, my name is Matilda Wade and I'm coming to present my unique case. It is called charcoal joint. A 36-year-old male patient came in for a foot and ankle x-ray. By taking his medical history, he said he has been having pain for 1 year. He also said he has his second toe amputated because it was infected and the doctors did not want it to spread to the whole foot. In his referral, it stated that he has a charcoal joint. And according in protocol for that site, for foot x-ray is AP, oblique, and lateral. And that's what we did. This is the AP. So according to radiologist findings, there is an amputation of the second toe and also section of the distal end of the fifth metatarsal with maintenance of the toe present. So here is the second toe amputation and distal of the fifth metatarsal. And also there is an extensive extraosseous calcification at the base of the metatarsals. So calcification at the base of the metatarsals. This is the base of each metatarsal. So that's what he's trying to say. And also there is some lateral incomplete dislocation of the third, fourth, fifth metatarsal relative to cuneiform and cuboid. So these are the cuneiforms right here and the cuboid. So he said there's a dislocation towards the third, the fourth, and then the fifth. Again, the radiologist also stated that there is an extensive calcification along the shaft of the third metatarsal. So this is the third metatarsal. So this, as you can see, there's a whitish along the shaft of the third metatarsal. That's what it means. And also there may be a fracture at the base of the third metatarsal. Fracture at the base of the metatarsal versus abnormal articulation with the lateral cuneiform. Abnormal articulation with the lateral cuneiform. So there it is. And this is the lateral of the foot. That's what we got. As you can see, there is a swelling, the soft tissue. The edge of the soft tissue, you can see that the foot is really swollen, and there was a heat, so it was really hot, and that's what we got. So now I'm coming to explain what the charcoal joint means. So according to Foot Care Med, charcoal joint is also called neuropathic arthropathy. They continue to explain neuropathy as a term used to describe problems with the nervous system. And also they explain arthropathy as a term used to describe problems with the joint. And when they put the two terms together, they said neuropathic arthropathy is used to describe problems with the joint related to lack of nerve system input. And when they explain charcot, they say it refers to the progressive degeneration of weight-bearing joint, the process marked by bony destruction, bone resorption, and eventually deformity. Also, they also continue to say in 1968, Jean-Martin Charcot, a French physician, described neuropathic arthropathy problem in patients with advanced syphilis. At that time, people with diabetes did not live long because insulin was unavailable. It was in 1930s that neuropathic arthropathy was recognized in diabetics. It may also occur with several other diseases that affect the sensory nervous system. For example, alcoholism, leprosy, etc. In US, diabetes is the #1 cause of charcot joint, according to Foot Care Med. Also, this food chemist stated that diabetic neuropathy also involved the involuntary nervous system, which controls regulation of blood vessels and skin moisture, and may result in increased blood flow to the limbs, contributing to swelling and osteoporosis of the bone as the charcoal process occurs. Age difference. Patients who develop neuropathic arthropathy have peripheral neuropathy after being diabetic about 10 years. And patients with onset diabetes as a child may develop this in their 20s or 30s. There are 3 stages of charcoal joint. The first stage is fragmentation and destruction stage. During this stage, as the process begins, the joint and surrounding bone is destroyed. The bone becomes unstable, and in some cases, the bone is completely reabsorbed. This stage is identified by significant swelling, redness, and heat to the area. As the bones are affected, fractures can occur, and joints can relocate or shift in relation to each other. This can lead to severe deformity of foot and ankle. The process may last as long as 6 to 12 months. The second stage is coalescence stage. During this stage, the acute distraction process slows down, and then the body begins to try and heal itself. The swelling and heat begin to disappear. Once the acute process is resolved, and the healing is ongoing, third stage begins. This is consolidation or reconstruction phase, during which the bones and joints heal. During this stage, the foot may often be deformed, and if there has been enough distraction, fitting shoes may be very difficult, and prescription footwear and diabetic shoes are important to prevent ulcer formation over deformed areas. And the reason why I chose this case is that it is very important as radiographers. So if a patient comes in for lower extremities X-ray, it is always important to ask if they have diabetes, because if they have diabetes, especially when doing foot or ankle, since it's the most weight-bearing joint. Some of the findings may be as a result of diabetes, and it will be more easy it will be very helpful for the radiologist if we put that the patient is a diabetic. Also, as a radiographer, when we see that the patient has a charcoal joint, it is advisable to lower your technique, because charcoal joint comes with distraction with the bone, degenerative of the bone, which reduces the bone density so that you will not bend the radiography. When you do that, you also prevent overexposing your patient with double exposure. And this is my citation for my case presentation. Thank you.